Today we're going to talk about the 5 steps to an amazing birth plan. Number 1 is you want baby to choose their birthday. And the reason is because babies are actually the one that trigger our bodies that it's time for labor. And it's so cool how. So when your baby is in the womb, all of the buds inside their lungs are closed up. So they're practicing breathing by inhaling amniotic fluid, but because everything's closed up, they don't drown. It bathes those buds and then it comes out. So they're practicing breathing, but the oxygen is actually not coming from that. It's coming from the umbilical cord and the placenta. So when your baby is doing this, when their lungs are completely done being developed, they actually release a hormone. And that hormone gets in the amniotic fluid when they inhale it in. And then when they exhale it out into the uterus, that hormone attaches to the sides of the uterus and it stimulates it. It's kind of like an adjutant. It says, hey, I'm ready to come out now. So your baby's the one that's going to tell you when it's time to be born. Now, of course, do we have times when this doesn't happen as it's supposed to? Like you have babies that come super early, you have babies that come super late. So, which by the way, super late is 42 weeks or more. Anything before that is physiologically normal and perfectly healthy. So you really want to let baby let you know when their lungs are done developing. And of course, there's times when we have to go outside of that. If, mom has preeclampsia, we don't want to put baby and mom at risk by waiting until that day happens. We can support that baby and give them what they need to function amazingly well. But if everything's happening normally, we really want to give baby the best shot to do what they need to do to let us know when they're ready. Step 2, we talked about in a previous video, is choosing a birth location and a care provider and overall birth team that is supportive of your desires. And that's for the whole team entirely. If you are wanting to do a VBAC and your doula does not believe in VBACs, which I've never heard of one not believing in VBACs, but they might be out there, then you probably don't have the best doula and you need to pay the deposit that you got for her and then move on to a different doula. Your care provider, if he's not supportive of you having a VBAC, it's going to be so much harder to have a VBAC, and you don't want to be fighting your care provider on your options. If you're wanting an epidural birth and your care provider really wants to avoid doing epidurals, then you might need to find a different care provider. So be honest with how you feel and what your needs are for your birth. Step 3 is you have to be your own advocate. Even if you have a doula, even if your midwife or OB says that they will help you get informed consent, you ultimately are responsible for advocating for yourself. Now, when I'm a doula and I'm working with my clients, I never get in between them and the care provider. I never say, oh, excuse me, my client wants delayed cord clamping. It's not my job to speak for you. What I do instead is I look at my client and say, hey, your doctor's getting out the clamps to clamp the cord. Are you ready for that? And because, after your baby's born, you're so absorbed with the little face, and sometimes you don't see the things that are going on around you. And so then my client can say, oh, doctor, I wanted to wait 15 minutes before I clamp the cord, or whatever their preference was. And so what my job as a doula is facilitating conversation between my clients and their care providers. And if you don't have a doula, then that responsibility is fully on you to make sure those conversations are happening so that you get what you want. Now, someday, we won't have to say that. Someday, every care provider, every nurse, everyone will just ask for informed consent and get the information from you and only do what you give them permission to do. But unfortunately, right now, we're not quite there yet. I see informed consent being violated. I've seen it happen at home births, birth center births, and hospitals. So you have to be your own advocate. You have to do what it takes to make sure that your wishes are being fulfilled. And that's a conversation that you need to have between every member of your birth team, your partner, your mother, and your care provider, your doula, everybody. You need to be having these conversations with them. The more you talk about it, the more confident you will all feel in how to behave at the time of the birth and before and after as well. Number 4, and this is arguably informed consent with your care provider is super important, but honestly, I think this one's the second most important. Super important is having relaxation techniques ready to go. And the reason why is it's hard to learn relaxation techniques in the moment in labor. I want you to be a pro at taking deep breaths, at calming your mind, at telling affirmations to yourself. Because truthfully, as we're going to talk about in another part of the program, the work of labor is not pushing the baby out. The work of labor is letting go and letting your uterus do what it was designed to do, because your uterus is going to push the baby out, whether you want it to or not. And so really, our main job is taking deep breaths, relaxing our pelvic floor, staying calm, reminding ourselves of our strengths and that we're safe and that everything's going well. That's going to be the work that you need to do prenatally to prepare for it in labor and birth. Number 5, avoid interventions whenever possible. Now, we're going to be talking about interventions in another video, but an overview is an intervention is anything that is done to your body that is not already happening within your body. So for instance, the contractions, not an intervention. The essential oils your doula offers you technically is an intervention. So anything that is done outside of you. And we're like monitoring baby, IVs, epidurals, massages, everything that's happening outside of you. So whenever you allow interventions to come into your labor and birth space, you want to be really knowledgeable about each one. And is that something that you want to take on? Now, essential oils, risks for them, pretty much close to nothing. Technically, everything carries some amount of risk. So if I'm putting jasmine essential oil on your belly, there's like a 0.0000 something chance that it'll make your contractions strong and maybe stronger than your body was ready for them. But it's also easily in and out of your system. We don't administer much essential oils in my experience, and that's midwives, doulas, all of us, we're doing small doses. So it's not like we're bathing you in jasmine essential oil, you know. And IVs, you know, those are an intervention and they do carry some risk of increasing your risk of a C-section. It's just the way it is. It's not a huge risk, but it is a measurable risk. Epidurals carry the greatest risk of all for having a C-section, but again, it's not only risk, there are some benefits. So really analyze each of your intervention options and decide, what are you comfortable with? What do you think that you would be happy with? What are some things you would rather try instead? Like for instance, Pitocin is a beneficial drug when needed, carries a lot of risks. Pumping, almost as effective as Pitocin, and carries way less risks and easy to shut on and off. So kind of keep those things in mind as you're working with your care provider. And one of the PDFs is a list of the traditional interventions that you'll have that are things that will be offered at a hospital and sometimes birth centers and home births as well. And then there's also a PDF for coping techniques. So those are all there. And you can really kind of like checklist off like which ones are like, oh yes, I feel comfortable with this one, this one, this one, and this one. I don't want to do these ones for sure. I want to learn more about these. So work through that PDF with your partner or your birth team and kind of decide, what do you feel comfy with?